Hello, good day. This is Dr. Chudi Ufondu of Inspirations Global Health Solutions. Thank you so much. I hope you're having a wonderful weekend. Today is the seventh day of the 8th month of 2021. And every Saturday about this time, we normally check in with our audience and kind of catch up. So it's called a word round. So our word round is an opportunity to touch base with our audience and look at a couple of things we can provide as feedbacks. Now, pretty much what we're going to do in the next 30 minutes is to have an interactive session. So you come in with your questions related to your health, then I'm going to give you feedbacks. What we use in our channel, it's pretty much the teaching model for the female reproductive system. Because a greater percentage of our members are women who are looking for babies. So infertility is a top contender in the issue our group solve. We've helped so many women to know their body better. We've helped so many women to understand where the problems might be so they can seek solutions. So this is what we use every single day to help bring the knowledge you need so you can change your knowledge base, change your attitude, change your practices, change your perception so you can become. So to start with, it's important you know the various parts of the female reproductive system. So this is the vagina. When you go beyond the vagina, you get to the cervix. This is an important part of the female reproductive system. The cervix needs to be completely closed if you succeed in becoming pregnant. We want the cervix to be what? Completely closed. A weak cervix when you become pregnant can lead to premature delivery of your baby. Now, prior to pregnancy, we want your cervix to be open so that the sperm can come in, go in, and continue with the process of fertilization. When you go beyond the cervix, you get to the womb. Beautiful part of the female reproductive system. This is about the most important and the strongest organ in the body. When you go beyond the womb, you get to the tubes. So the tubes are like two bridges hanging over the womb. So the whole of this area is actually the womb. You can see it's a very strong, thick, muscular organ. But hanging on the womb are two fallopian tubes. So every woman is equipped with two fallopian tubes. Your fallopian tubes are the conduits, which will help the air which will be released from this end to go to the ampulla. So this part of the tube is called the distal part of the tube. This is the midpoint of the tube. This part of the tube is called the proximal part of the tube. The proximal part of the tube is where the sperm will come in. The middle part of the tube is where the fertilization will occur. It's a special place called the ampulla. Then this is the distal part. So when the egg is released, it's going to be suctioned in. You can see that this part has some finger-like projections. When it gets through this side, it's going to lay siege and wait in the ampulla. Then the sperm will come in. And after fertilization, they will go back and implant in the womb. This is the basic way the body of a woman is structured. Now, to start the open clinic, please identify with our audience. Identify with the admin. So if you need any help, admin is going to help you this afternoon. So admin, please, can you quickly rally so we can start the conversation so I can see people in attendance? So can you ask all your questions so I can provide you feedbacks? I'm planning to spend 30 minutes. So in the next 30 minutes, I'm going to give you feedbacks on any question you have related to your health. So admin, if you wouldn't mind, you can go ahead and start asking questions. Any question whatsoever. Okay, so thank you for coming. It's our word round. It's an opportunity to get feedbacks from me, and I'm going to be providing you with feedbacks. So please go ahead and start asking your questions. Start asking questions, please. What are the cardinal things you need to be conversant with if you want to become a mother? If you want to become a father in 2022, you have to know about your ovulation. So because ovulation is a must, you cannot become pregnant if you're not ovulating. So there is no way to become pregnant and become a mother if you don't have eggs. Ovulation is simply the release of those eggs you have already. Now, on the last Sunday of this month, we are going to have a boot camp. Boot camp is a special opportunity for you to learn things on a fast track. So make sure you follow the links, register and participate. It's going to be amazing. So many women are going to get help. So many people are going to get all the tools they need to become. Now, I have one question on the floor. Doc, what's the best option for a woman with both tubes blocked? Now, in trying to become pregnant, it comes with a lot of challenges, and most of those challenges are emotional challenges. It's actually very, very stressful to want to become a mother, and you're not able to become a mother, and they begin to tell you a lot of things. Now, if you have tubal factor infertility, so tubal factor infertility means either this part of the tube is affected or this part of the tube is affected. So you have two tubes. The beautiful thing about the way God structured the female reproductive system, any place you have two parts of the body, you can compensate. So if anything happens to this part of the tube, this part of the tube can also function properly. So for a woman to become pregnant, she actually needs just one functional part of the tube. So if this part is damaged and this part is good, you can become pregnant. Now, talking about blocked tubes, there are a couple of factors that can lead to blocked tubes. Top on the list is PID, pelvic inflammatory disease. Pelvic inflammatory disease can happen when you have an infection. Two on top of the list is chlamydia or gonorrhea. So if you contracted chlamydia or gonorrhea and it wasn't properly treated, or it was not even diagnosed, it can go to your tubes and it can form the complex we call pelvic inflammatory disease. Pelvic inflammatory disease can block your tubes. Now, blockages can be in different ranges. It can be mild blockage, it can be moderate blockage, or it can be severe blockage. If you are blessed and only one part of the tube is blocked, then this part is open. This blocked tube, we can forget about it, and you can still have all your babies with the other tube. Unfortunately, if you have both tubes blocked, confirmed blocked, your best option is what? IVF. Why is IVF your only option if your two tubes are blocked? Because imagine if this part is blocked, the eggs cannot come in. If this part is blocked, the sperm cannot come in. In some situations, the eggs can come in, the sperm can come in, but in the course of trying to go down, they can be arrested in the tube. Any pregnancy developing outside the womb in the tube is called ectopic pregnancy. It's a very deadly form of pregnancy. We don't want that to happen. So what do we normally do? We cut off that part of the tube. But our prayer is that even if a woman is having problem with the tube, let it be only one side, because with this side, you can still become pregnant. Now, the criteria for you to become pregnant is your egg. So in the whole pathway of getting pregnant or not, the important thing in the body of a woman is the egg. So long as you have your eggs, you can have your babies naturally. You can have your babies through assisted reproductive technique. So in this lady with two block tubes, what are we going to do? We're going to chill. It might be difficult. It might be emotionally challenging, but guess what? We are going to chill. We are going to make sure that the woman still has some good eggs. We'll collect the eggs. Then we go to the partner. We collect the sperm. We join both of them together in a lab. That's simply what assisted reproductive technique is all about. That's simply what IVF is all about. So a woman that has two tubes blocked can still become pregnant by going for what? IVF. So if that's your situation, stop moving from one place to the other where they will be promising you to flush this, to flush that. You're not going to get pregnant that way if it's severely blocked. The earlier you start accepting that you need help, the earlier you start making arrangements for IVF, the better. Okay, that's a very, very good question. Okay, the following question is, why is IVF the only option for blocked tubes? Let me go back again. The only reason which we have to resort to IVF is because this bridge is already closed. So imagine yourself going to Onitsha. Onitsha, it's in the eastern part of Nigeria. Now, when you get to Asaba, we have a very big bridge that will take you through the other side, which is Onitsha. So imagine yourself, you have to do something in Onitsha. desperately. You have to be in Onitsha, any which way. But by the time you came to the Niger Bridge, it was blocked. Heavy traffic, blocked. But you have something you need to do in Onitsha. What are you going to do when you have yourself in this situation? You are going to enter a canoe, or you are going to swim, or you are going to enter a helicopter to get to the other side. This is what happens when your tube is blocked. Entering a helicopter, swimming, or using a canoe, it's your IVF. So when your tubes are blocked, the natural role of the tube will not happen the way it's meant to happen. But we still need to become pregnant. We still need our kids. In that situation, we begin to look for IVF. In IVF, what do? We collect the eggs from the woman, we collect the sperm from the man, we join both of them together in the lab. When we confirm that they have formed embryo, we transfer the embryo back into the womb. The moment we have finished transferring the embryo back into the womb, that pregnancy is exactly the same thing with naturally conceived pregnancy. There is absolutely no difference. Once we have confirmed that pregnancy has successfully happened inside the womb, that pregnancy is 100% the same thing with pregnancy you achieved naturally. So that's why you need to go for IVF if IVF is your only option, if your two tubes are blocked. Very smart question from my admin. So please keep on asking your questions. Keep on throwing all the questions. So assuming you are in our group now and a couple of our members are asking questions, I want you to simulate those questions, ask me the questions, then later we are going to share it with them. It looks like people are still getting used to our YouTube, but we want to expose ourselves to as many as possible to hear the good news. So please, Chi and Onyinye, please keep asking your questions. Ebenezer, if you're also out there, keep asking your questions. Keep asking me questions so I can, put in the feedbacks to our audience. Okay? Make sure you register for the ovulation and pregnancy bootcamp. This month's masterclass is a bootcamp. When you go to a bootcamp, it's all or none. In our group, it's all or none. In 2022, it's either we become pregnant or we don't become pregnant. We're not actually becoming pregnant. One thing is becoming pregnant. Another thing is carrying the pregnancy and having your baby. In our group, from the first day of January 2022, we are going to buy our dancing shoes. We are only going to celebrate. We cannot carry over infertility from 2021 to 2022. So every singular member of our group must be fully equipped with what they need to succeed. Okay? All right, Doc, can a woman who is 46 years old planning to go for IVF use her eggs or donor egg? Smart questions from, very smart audience and very smart moderators. So here's the deal. One of the factors that can affect your ability to succeed in becoming a mother is your age. When you are getting old, your eggs are also getting old. By the time you were born a girl, you already have all the food sets of the eggs you will use to start your family. But as you're getting old, you'll be losing them in so many quantities. But averagely, you have about 400 eggs to start your family. Now, as you are getting to 35, there will be a sharp drop in both the quantity and the quality of your eggs. So the younger you are, the more you have normal eggs. But the older you are, the more you have abnormal eggs. So consider having about 12 dozen eggs last 12 years. You keep it in a fridge and you're in Nigeria and you know that once in a while we have up NEPA. They take the power. When you come back 12 years time, are those eggs still going to be fresh? No. Some of them would have been damaged. This is what happens when you get old. You might still have some few eggs remaining, but majority of them would have become abnormal. Now, my sister, you are 46. By 46, one of the most important things we have to consider first before you go for any other thing is what? Ovarian reserve test. So we have to take a critical look in your ovaries and even decide and even assess and evaluate if you still have eggs. So the number one test we have to do for a 46-year-old is to run an ovarian egg reserve test. We check your FSH, your follicular stimulating hormone. We check your AMH, anti-Mullerian hormone. These two hormones can give us an indication if you still have eggs. Then if you still have eggs, how many of them are of good quality? Sometimes you can also do follicular tracking to look at, a couple of follicles you have. Now that's the rate limiting step. That's the determining factor if you are gonna proceed with your donor egg or your own eggs. Now I will tell you this without any prejudice and without any sentiments. For our members, once you get to 35, begin to think outside the box. When you get to 40, if you are planning to go for IVF, your best chance in getting good outcome is donor eggs. The reason is because at 40, the possibility of not having good outcome is there. So when you are going for assisted reproductive technique, it's a give and take situation. So if you have good eggs, that's what we're going to use. If you have bad eggs, that's what we're going to use. So, but you don't want to go using a bad egg for something that will fail. Becoming pregnant is not an experiment. So if you have to spend a lot of money, if you have to go through a lot of emotional trauma to go for IVF, you have to go with quality eggs. So when we are going for donor eggs, we are looking for a younger lady who doesn't smoke, who is not hypertensive, who is not diabetic, who has very good indices, who has absolutely no disease condition in her body. Then we are going to use her eggs. So when we are going for donor eggs, we are looking for younger women who are qualified. It's not just, going to the street and bringing any woman to give them their eggs. No, it's a very carefully planned process. So generally, I will advise any member in our group, if you have tried your best to become pregnant and you're not successful, you are in your 40s, please, when you get to the fertility specialist, consider using your donor eggs. Now, here's the deal. Regardless of what the diagnosis is, regardless of how long you've been looking for a baby, 20 years, 30 years, 40 years, it doesn't matter. So long as you are alive, don't stop love making with your partner. Any woman at any time can suddenly become pregnant naturally. So even at age 50, you might, the key word is might and can become pregnant, even if you have one egg. And the beautiful thing about old age in women, the older you are, the more the likelihood you're going to have multiple pregnancy. So this lady in her 46, if she takes the bold step of going for IVF with donor eggs, she can have triplets, she can have twins, she can even have quadruplets. So you have a higher tendency, you have a higher probability, you have a higher chance of having multiple pregnancy when you're older. So you need to take your bold step. But personally, go for your ovarian reserve test. If you still have good eggs, go with your eggs. If not, donor eggs. Don't even blink. Go for it. Unfortunately, it's expensive. So make sure you have enough resources to power this. My prayer is very simple. This is the 8th month. It takes 9 months to conceive, carry your baby through first trimester, second trimester, third trimester, and having the babies. My prayer for this lady at 46 is that she will take a bold step, and in 9 months' time, she will climb our stage and she will begin to testify of how she overcame infertility. Very good question. I love that. So please consider donor eggs. Okay, so guys, let's continue. Good evening, Doc. God will continue to bless you with knowledge for the word of knowledge. Thank you so much, my dear. If you have questions, please keep asking, okay? What can one do to avoid miscarriage in PCOS patients? So you see, my dear, most miscarriages are caused by what we call chromosomal problems. So in chromosomal problems, what happens? So before you and your partner come together to start planning for family, you got 23 sets of chromosomes from your mom. You got 23 sets of chromosomes from your dad. We combine them to have 46. So an individual has a mosaic of 23 from the mom, 23 from the father. Now, when you meet your partner and both of you are planning to bring forth your babies, in course of exchanging the chromosome from the dad or the mom, it can have error. You can have abnormality. So that on its own can lead to miscarriage. Most miscarriages are caused by chromosomal problems. In chromosomal problems, there is nothing anybody can do about it. Nobody can stop chromosomal problems from happening. The body is structured in such a way that the only thing the womb will accept is the best. So remember that miscarriage is the unintended loss of your pregnancy before 20 weeks. So our body wants the best. So if a miscarriage is happening in the body of a woman based on chromosomal problems, the body is already rejecting that baby because that baby is not the best. The way the body will reject the baby is to make sure that the cervix is open, so the woman will start bleeding, water will start coming out, you start having pain. So most miscarriages are caused by what? Chromosomal abnormalities. Some miscarriages can be caused by a couple of other factors. Top on the list is hormone imbalance. There are 2 hormones that maintain the cover of your womb to make sure it's adequate in thickness, your estrogen and your progesterone. So in some women, if they have poor level of progesterone, which ordinarily should be the protective hormone, which should be the pregnancy maintaining hormone, the cover of the womb will not be thick enough. So you have thin endometrium. When you have thin endometrium, you will become pregnant anyway, but the pregnancy will not succeed because when your endometrium is not thick enough, the foundation of that pregnancy will not be strong enough. So just consider someone that built a house on a sand. When wind comes, wind is going to destroy the house. This is what happens in pregnancy. So some women can have low level of progesterone. If we discover that that's the problem, we can give you some progesterone supplement. Some women can have infection. There are a couple of infections that can lead to miscarriage in a woman. So if you are prone to miscarriages, we have to investigate. We have to do everything possible to make sure we can correct the ones we can correct. In some women, they can have cervical incompetence. That means the integrity of the cervix is not strong. Remember when I was introducing this body, I told you that the cervix must be completely closed in pregnancy. Anything that affects the integrity of the cervix in pregnancy, the cervix is not going to be strong. It will open and the baby will be completely miscarried. Now, if you have cervical problems, we can use what we call cervical sacklage. So we can use a special suture to tie the neck of your womb, which is called the cervix, and allow you to carry your baby up to term so you can have your baby. So these are the few things that can lead to miscarriage. Now, if you want to have good outcome, pregnancy must be well planned. So in your own case, you already have polycystic ovarian syndrome. In polycystic ovarian syndrome, for some reasons, when we come to the ovaries, we have multiple fluid-containing substance, which ordinarily shouldn't be. When we have such, it will alter the function of the ovaries. The woman will not ovulate. The woman will be elaborating more male hormones, which are called androgens. When you have more androgens, it's not going to allow you to ovulate. When you don't ovulate, you cannot have a baby. And most of these women that have polycystic ovarian syndrome will manifest with some male characteristics. So some women will start having what we call hirsutism, hair distribution like men. Some will start adding body weight. Some will start having what we call insulin issues because when you have additional body weight, the handling of blood sugar in your body will be affected. So part of the management is also to give the women some anti-diabetic drug. Top on the list is metformin. So polycystic ovarian syndrome by its own merit can stop you from becoming pregnant. So you need the help of a fertility specialist and an endocrinologist. An endocrinologist is a doctor that is only specialized in everything hormone. So if you have hormone imbalance, it's an endocrinologist that can work to make sure they modify it and make sure it's within the normal range so you can become pregnant and have your baby. I love that question. So guys, keep asking your questions. Keep asking your questions. Doc, if a woman is pregnant with a weak cervix, what would be done to make sure she doesn't lose her pregnancy? Cervical sacklage. cervical sac flight. So if we confirm that the woman has poor cervix, we are gonna tie the cervix with a special suture called cervical sac flight. It's actually called shrub cap. There are different types. When we do this, we are also gonna support that woman with progesterone drops. We are gonna recommend bed rest. Now listen to me carefully. In your pregnancy, anytime you notice bleeding of any shape, of any form, spotting, frank bleeding, heavy bleeding, there are 3 S's you must observe. You can capture this for me, admin. No sex, completely no. No spots, completely no. No stress, sex, spots. Once your pregnancy is compromised, we must go above and beyond to protect that pregnancy. So you have to discontinue all forms of sex with immediate effect. You have to avoid all forms of spots with immediate effect. You have to avoid all forms of stress. So a pregnant woman doesn't have any business stressing, because the danger you can cause to your baby can actually be painful. So you must be as calm as possible. If we tell you to stay on bed rest, please stay on bed rest. If you tell you not to make love, please don't make love. If your partner cannot contain it, you can buy soap for your partner. But there is no love making when your pregnancy is compromised. Very important. Okay? I love that question. Okay, so you noticed you're having irregular periods. Though you gave birth 18 months ago, you are not on any medication. How can you calculate your ovulation? Because you're planning to get pregnant. Very, very important question. Now, first of all, make sure you register for the ovulation and pregnancy bootcamp. You are going to learn a lot. You are going to learn about the signs of your ovulation. You're going to learn about your fertility window. You're going to learn about ovulation disorders. You're going to learn about things that will help you to become. Now, in your own situation, you gave birth 18 months ago. So if you're planning to give birth about this time, this is actually the right time. We always advise women to have at least 18 months gap before you think of having another childbirth, so that your body will recover. Now, it's not unusual to have irregular periods when you deliver a baby. Why? Because your body is still trying to adjust. So what you need to do is to pay attention to your body. Go and mark the differences on your calendar. Begin to know the dates. Now, you need to also modify your lifestyle. So you need to make sure you drink a lot of water. You need to make sure you stay healthy. You need to make sure you exercise. You watch your body weight. You eat healthy. If you can take care of your body from lifestyle perspective, your body can normalize on its own. Now, if you notice that your period is completely all over the place, this month is 45, next month is 10, the other month is 60, then you need to see a gynecologist, preferably a fertility specialist, so we can help to track what's going on in your body. Now, remember, some women might not bleed, but they are ovulating. Some women can bleed, but they are not ovulating. The cardinal thing that must happen in the body of a woman for her to become pregnant is what? Ovulation. Some women, shortly after giving birth, their period will cease. When you don't have your period, it's called amenorrhea. The fact you are not bleeding as a new mother doesn't mean you're not ovulating. There are so many new mothers can quickly become pregnant within a space of 2 months, 3 months, simply because they ovulated before they bled. But the practice is to wait for your bleeding to come back before you start avoiding pregnancy. No, you start immediately your discharge from the hospital. Very, very important. Okay, so I love that. So calculating your ovulation when you have a regular period can be tricky. So I will encourage you to register for the upcoming bootcamp so you learn better. Okay, so now if you're coming in, it's open clinic, it's my weekend ward round. You have an opportunity to ask me questions. I'll give you feedback. Okay, so when you come in, quickly settle in. The clinic is actually running for the past 30 minutes, but I will still give you one of few opportunity to ask me questions. So once you come in and you're settled, please start asking your questions. I'm going to give you feedbacks. Then we're going to go and get a good rest. Now, later today in this channel, we are also going to talk about 5 things that can help you to have healthy sperm. 5 things. So keep a day with me by 7 p.m. today, US time. I'm going to talk about that. We're going to have about 10 minutes to knock it off. But right now, please ask me questions. If you have any questions, if you need any clarifications, this is an opportunity to get feedback from me. Now, remember, regardless of whatever problems you have, pray always. Prayer works. So our motto is PPP. Pray, play, practice. Pray 24 hours, play 48 hourly. Playing means make love to your partner 48 hourly. Make love today, skip tomorrow. Make love the other day, skip. So every other day, especially for our members that have been having infertility for a long time and you are above 35, the more you engage in the act of lovemaking, the more you're improving your chance. We do not practice ovulation or fertility window sex in this room. We don't practice that because it can work against people. The only people that can correctly pinpoint their cycle and ovulation are women that are younger. So please don't practice ovulation. Just make sure you just make love around the corner, okay? Doc, a woman that sees her period for just 2 days, is it normal? Beautiful question from my amazing admin. Yes, 2 days is the lower limit of normal in the duration of bleeding. The normal range is 2 days to 7 days. So if you are only bleeding for 2 days and it's frank bleeding, it's completely okay. It's on the lower spectrum of normal. If you're bleeding for complete 7 days and it's normal, that's okay. The problem is when you're bleeding for just 1 day or when you're bleeding for 8 days up, then we begin to be worried. But 2 days bleeding, completely okay. Okay? Correct. Regardless of your diagnosis, keep on praying, keep on playing. Keep on practicing. Keep on praying. Keep on playing. Keep on practicing. Keep on showing up. Practice. Practice. Now, this is August. If your New Year resolution in 2021 is to populate your family, to complete your family, but in August, you haven't tested positive, you don't have the babies you're looking for. Now, the big question is, who is helping you? Do you have a fertility specialist? What are you doing about it? Have we identified what the problem is? Do we have a diagnosis? Is it a male factor problem? Is it a female factor problem? What exactly is the problem? So you see, most times we don't even go to seek help the right way. We believe that God is just going to come down and give us what we're looking for. If you are not a mother yet, but you know that the biggest prayer you said on the 1st of January is to become a mother, you need help. If you have been doing the right things for 6 months, you are 35 years and above. At the end of the 6th month, transition to getting help from a fertility specialist. If you are below 35, that means you're 34. You've been doing this for 12 months and you still are not able to become pregnant. You need help. If you're a father-to-be and you haven't yielded to go for your seminal fluid test, you need to come down from your high places and you present yourself to a urologist so we can seek help and start helping you as soon as possible. There are some families that are not complete today because the man is the problem. Review your relationships. If you're in a toxic relationship, if you're in a relationship where the man is the reason why you don't have a baby today, you can afford to leave that pregnancy. You cannot afford to waste your 30 years, 40 years, or 50 years of life with someone that wasn't even wishing you well in the first place. There are so many people out there that will love you right. If you entered your relationship with the aim of having your babies and you don't have your babies now and your partner is not on the same page with you, change your ways. I can only advise you. At the end of the day, you will be the person that will take your decision. So if you need help, we can help you. Admin can set you up. Admin can give you everything you need. We have different consulting packages. All you need to do is to show up. Then admin is going to help you. Admin, can you quickly copy all the different packages we have from 1 week, 1 month, 3 months, 6 months, share it with them. Then if you need to get help, follow through, subscribe, come in and we can help you. Thank you for coming for today's word round. Now, tomorrow is our maternal and child health clinic. We're going to get a very good topic. We're going to continue the conversation. There is no day you come to the group and you won't get help. So please share this video. Make sure you subscribe to our channel. So when I'm done, just go to that channel, click subscribe, click on notification. When you subscribe and click on notification, what's going to happen? Anytime I'm coming live, they will tell you, oh, Dr. Chudi is going to come live. That way you will catch up and you won't miss any of my live broadcast. But in the event you missed it, you can always come back and review. Okay, but I appreciate you guys. In the absence of any other question, I'm going to take my leave. So if you still have questions, please still go ahead and ask. Okay, you are experiencing all the aforementioned, no period, except when they place you on drugs. But after the miscarriage, you saw your period twice. They placed you on metformin, but you're still experiencing weakness. Now, my sister, if you have a diagnosed polycystic ovarian syndrome, make sure you modify your weight. So exercise, drink a lot of water, avoid stress, avoid alcohol, avoid eating a lot of calorific food. If you can work on your body weight, you can give yourself a better chance. So I hope you have a fertility specialist with you. Very, very important you have a fertility specialist. A fertility specialist can guide you, and fixing infertility, it's not a quick fix. Now, the fact you were able to achieve pregnancy in the past shows you can become pregnant again. So when you've been pregnant in the past, but currently you're not able to become pregnant, you have secondary infertility. But if you have never been pregnant in your life, then you have primary infertility. So the fact you were pregnant, but unfortunately you had miscarriage, you can still become pregnant again. So what I will advise you to do is to do what? To step up and make sure you're consulting the right doctor. There are so many people that are not pregnant today because they are not seeing the right doctor. If you are looking for help, you need to look for help from the best. The best person to help you with fertility problem is a fertility specialist. Okay? Can low sperm count deprive pregnancy? 100%. 100%. So when you don't have adequate count in your sperm, it's called oligospermia. So it's a factor that can stop you from becoming pregnant. But more importantly, if in that little quantity of sperm you have, and they are not moving, that means you have motility problem. And they are not looking good, that means you have morphology problem. Then the possibility of you impregnating your partner is reduced. But here's the deal. Regardless of the low sperm count, you are still advised to continue making love with your partner. So the fact you have low sperm count doesn't mean you are absolutely not able to make your partner pregnant. It means you can, but there are so much effort you have to put into it. So if you have any form of sperm issues, you need to consult with a urologist. Besides whatever supplement or treatment we're going to give you, you need to modify your life. You need to make sure you're not drinking alcohol. You need to make sure you're exercising. You need to make sure you're working on your body weight. Very, very important. Okay? All right. Good afternoon. God bless you. Why do IVF fail? Very, very big question. So you see, IVF can fail on any of the phases of the process. IVF can fail if the egg is not good enough. So this is where it's very important we do your ovarian egg reserve. So if your egg is good quality, good grade, that's a plus. IVF can fail if the sperm is not good enough. So if your partner doesn't have good quality sperm, IVF can fail at that point. IVF can fail if you have infection. IVF can fail if you have hormonal imbalance. IVF can fail because of the person administering the IVF. If they don't have good storage facilities, if they are not actually qualified, the IVF will actually fail before you start. Now, IVF can also fail because of your age. Now, sometimes we don't know why it fails, but guess what? Regardless of whatever happens, if you're going for IVF, always request for comprehensive test so that at any point in time, we can evaluate and check and make sure that everybody did what they were supposed to do. So IVF can fail because of the egg. It can fail because of the sperm. It can fail because of lack of implantation. So if you have any problem with the implantation, that means the cover of your womb is not adequate enough. IVF can fail there. If you have any overwhelming infection, IVF can fail there. If you have structural problems in the womb, IVF can fail. So IVF can fail at any of the levels I mentioned. Okay? Can you get a fertility specialist in Sapele Delta State? So currently, I don't have a provider in the location you're mentioning, but I have a provider in Asaba. So the closest place I can refer you is in Asaba. But here's the deal. Hey, my people, it doesn't matter where we get the best. Just go for the best. There are people that travel from America and reside in America. There are people that travel from America back to Nigeria and they get their results. Matter of fact, this particular shirt I'm wearing is from one of our clients, an ambassador. She traveled to Nigeria. She's pregnant. She's going to be a mother from America. So it doesn't matter where you live. The most important thing is that you're going to be a mother. So if you need help, follow up with admin. Admin is going to set you up. Then you're going to get help. If you need to consult me privately, follow admin. Admin is going to set you up. Then once you come in, you will have an opportunity to be consulted. Okay? So do we have any other question? If you have any other question, feel free. Make sure you follow this channel. Every day you show up, you definitely have something to fall back on. So if you're just coming in, we're talking about our wardrobe. We're trying to give you feedbacks on things you need to know. Can vaginal sacklage prevent miscarriage? Vaginal sacklage is actually a preventative procedure to give you a better chance. There are no guarantees. So there are some women that still have cervical sacklage and they still lost their baby. But if that particular problem is coming from the cervix, we can fix the cervix problem. But there are a couple of other things that can happen. So there are no guarantees that, oh, once you do this, it's going to happen. What you need to understand, my dear, you have polycystic ovarian syndrome. So you are a special candidate for consulting a fertility specialist. Now, when you're consulting a fertility specialist, you have to be very patient. Success doesn't happen overnight. So if we give you drugs, follow your drugs religiously, then modify your own lifestyle. Then while you're doing all this, continue making love to your partner. Can genetic blood pressure have effect on pregnancy? So what's genetic blood pressure? There is no such thing, my dear. Some people can have hereditary factors. So if your father is hypertensive, if your mother is hypertensive, you can actually inherit that gene. So you might have hypertension in your family. So you have predisposition to having hypertension. Okay, so the key word is prevention, right? Now, can hypertension and diabetes affect your ability to become pregnant? To an extent, though indirectly, but they can complicate your pregnancy. So if you have poorly controlled hypertension or poorly controlled diabetes, they can complicate your pregnancy. When they complicate your pregnancy is not going to go smooth. Some people can have miscarriage. Some people can have stillbirth. Some people can have a couple of other complications. So the key word is, if you have diagnosed hypertension or diabetes or any other chronic health condition, you have to make sure it's properly controlled before you plan to become pregnant. Okay? So my time is up. Thank you for coming. I appreciate you. Join me later today. If you're still up, it's going to be, I think, about 12 p.m. Nigerian time. It's going to be 7 p.m. my time. I'm going to show up and we're going to talk about 5 things that can improve the health of the sperm. 5 things you can do to improve the health of the sperm. Invite your partners. Make sure you subscribe to this channel. If you subscribe to this channel, share the good news, follow through. Now, if you're in our channel already, when we are done with this particular broadcast, please make sure you go and review all the important videos. We've had thousands of life-changing videos that can make your life better. I appreciate you guys. If you no longer have any other question, I'm going to take my leave right now, okay? But thank you for coming. God bless you, and I'll see you later today and tomorrow. Make sure you register for the ovulation and pregnancy can be the difference. The difference between you not being a mother in 2021 and being a mother in 2022 is what? Action. Admin, capture that for me. The difference between you being a believing for baby mother in 2021 and being a real mother in 2022 is what? Action. That's the difference. I want you to act. I want you to pray. I want you to continue making love. I want you to see a fertility specialist. There are some days you don't feel like making love. There are some days you want to go quarrel. There are some days you want to go to the guest room. Those days are the days you become pregnant. Avoid them. Avoid things that don't matter. Things that don't matter don't matter. We don't have the liberty of wasting time in this group. Okay, so thank you so much. And I'll see you guys later today. Bye-bye for now. God bless. Okay, here we go.